Hello guys, in this video we are going to discuss split versus full thickness skin graft. It is a topic from general surgery part, right? It is specially taught in burns topic, right? So what is the difference between split and full thickness skin graft? First, in split thickness skin graft, what is the most common site? The most common site is thigh. In split thickness, it is most common thigh is thigh more than buttocks, right? Thigh more than buttocks. Then in full thickness skin graft, the most common donor site is post auricular skin or supra or infra clavicular fossa skin. Easy. Then if puncture hemorrhages are seen when the graft is raised, if puncture hemorrhages are seen when the graft is raised, what does it mean? That right thickness of the graft is used. Right thickness is raised, right? If you can see puncture hemorrhages, it means that right thickness is raised of the graft, right? It is a good sign that puncture hemorrhages can be seen. Second, donor site in full thickness skin graft, donor site is after raising the donor site is dash after raising the graft, right? Donor site is sutured, okay, because you are taking out the full thickness, that's why you will suture it. After raising the graft in split thickness skin graft, after raising the graft or meshing or scoring is done. Now why is it done? To increase the surface area. It increases by 1.5 times. So you can take the skin and you can use that skin and increase that surface area to cover a greater area where you want to actually put that skin, right? So meshing or scoring is done, right? And also it prevents fluid accumulation, right? Because those pores won't allow the fluid to collect underneath, fluid accumulation beneath the graft, right? Very important point for both of these, that donor site cannot be reused in both the types. Once you have used that particular site in split or full thickness skin graft, you cannot reuse the site for any type of grafting. Now there is a very important thing that I want to tell you, that primary contracture is directly proportional to the amount of dermis and secondary contracture is inversely proportional to the amount of dermis. Now what does primary contracture means? Primary contracture means as soon as I take that graft out from that original position, original location, I use my blade and take that graft out. As soon as I take that graft out, that graft or the skin will try to shrink. This is called primary contracture. Immediately after raising the graft, that graft will try to shrink. This is called primary contracture. And what is secondary contracture? The graft, after we place it at the recipient site, it tries to shrink. It is called secondary contracture. After placement, if it tries to shrink, it is called secondary contracture. So primary contracture is directly proportional to the amount of dermis and secondary contracture inversely proportional to the amount of dermis. You have to remember it. Now what will be the status of primary contracture in full and split thickness skin graft? In split thickness skin graft, this is split, this one is split, this is full, right? So in split thickness skin graft, what happens? In split thickness skin graft, it is split because you haven't taken the full dermis, and it is full. Full is called full thickness skin graft because from with the epidermis you also take the whole dermis. That's why in split thickness skin graft, because the dermis is less, that's why primary contracture will be less. And in full thickness skin graft, the dermis is more, that's why primary contracture is more, since it is directly proportional. Now the secondary contracture, the secondary contracture part, because split thickness skin graft has less dermis, that's why secondary contracture will be more. And just the opposite, in full thickness skin graft, secondary contracture will be less. Now seventh point, survival and take-up is better. For split thickness skin graft, survival and take-up is better, right? And more resistant to trauma. Who is more resistant to trauma? Of course full thickness, because it is full thickness, that's why more resistant to trauma. Who is cosmetically better? Full thickness is cosmetically better. What is used for burn? For burn we use split thickness skin graft. And skin bank stored for, and in skin banks we can store the split thickness skin graft for 2 to 3 weeks, very important, at 4 degrees Celsius. Now more important thing about grafts, right? This is the thing I discussed with you, but the most important part is actually here. Generally question are asked from this particular topic only. Graft survival methods. First is, in first 24 to 48 hours, imbibition. What is imbibition? Just like plants can seep water into themselves, these particular grafts, these particular skin grafts can seep blood and get the nutrition. This is called imbibition. When do they occur? It occurs within 24 to 48 hours. You will never be asked what is imbibition. You will ask that within 24 to 48 hours, what is the main method of graft survival, right? Similarly, you will be asked in 2 to 4 days time duration, what is the main method of graft survival? It is inoculation. What is inoculation? Capillaries grow from underneath the graft, and the capillaries from the graft also go towards the recipient bed and they share nutrients, right? Capillaries goes to nutrient, goes to recipient bed to get nutrition, right? Capillaries grow just like roots grow in plant. For more than 4 days, after 4 days, what is the main method of survival? Of course, it is neovascularization. For how many days will the graft will do like plant? Of course, it will vascularize itself from the underneath bed, neovascularization. So you have to remember the name basically, right? Neovascularization. Now, what is the most common cause of graft failure? Lastly, most common cause of graft failure is actually hematoma formation underneath. That's why meshing can be done, right? And infections are the second most common cause. But what infection do generally cause graft failure? Beta hemolytic streptococci. Beta hemolytic streptococci. So that's it, guys. Everything important about this particular topic is done.